during these times, people still find the value in learning about the latest developments in science and studies. And I think, as we move forward, certainly we're thinking much more about how do we complement physical Congress presence with virtual meetings. And I think we're going to probably see a mixture of the two, particularly as we know that, some of these restrictions and things like social distancing and those sorts of things are going to remain with us, for some time still. So I think, to me, that's a great example of how the world has moved in a positive way and allows clinicians and other participants to really use their time most effectively. So I think there's some really good examples as to how, using digital technology, I think we can still achieve our objectives as a broader community, but do it in a much more efficient manner.
Educational platform, in other words, the webinars, which are educational, that may just do the job just as well to raise awareness about, especially in your case, about products that are recognized globally, but it's really comes down to the education thereof. And so perhaps it works just as well.
Yeah, no, I agree. And I think what we're also seeing is, again, some of these digital technologies, I think a greater interest in telemedicine, for example. I think, it's still early days still, but I think as we move forward, I would expect that, ophthalmologists in particular will use those types of technologies. If we think about, if you think about the patient population with neovascular AMD or diabetic eye disease, they are in that vulnerable group. So being able to do some sort of remote monitoring or remote assessment, I think will become more important in the future, so that you can really minimize the time they spend in clinics, in hospitals, so that, really minimizing their risk. And so I think, to me, as we look forward, and I know some countries are already exploring these types of technologies, I think they will come to the fore, and we'll see real innovation. I think something that certainly we get feedback from a lot of our country colleagues is, historically health systems have been quite slow to innovate because of process and other issues.
Yeah.
But actually, at this time of crisis, I think suddenly that speed of innovation really increases. And we're seeing that now. I know, for example, where I'm from in the UK, historically, we've supported clinics with capacity challenges in terms of redesigning how they operate, but also setting up, for example, mobile clinics. And now suddenly we're hearing there's a lot more interest again in mobile clinics, because I think also from a system perspective, there's challenges.
Right.
But something that is actually being debated very publicly now in many countries is, will people feel comfortable going back outside into the sort of public space, going into a hospital, for example, where they know patients have had COVID are being treated maybe in a separate part of the hospital. But I think that sort of apprehension will be there. And I think if you could, for example, say, actually, we set up a remote clinic, a mobile clinic, separate to the primary facility, then I think, again, patients will probably be a little bit more comfortable going there to be treated.
The thing that I was curious about was, this phrase that we use in our community, treat and extend,
Yes.
Right now, we've really been on an extension, haven't we? And I'm curious as to how that might have affected patients worldwide, and whether, we're going to have to play catch up, and even if patients may have suffered a little bit as a result.
I think what we've seen over the last, I'd say 2-3 years is a greater interest in that treat and extend way of treating. So extending that interval really to a point where the patient can achieve the best possible vision outcomes whilst really extending the treatment interval.
Right.
Now, what we've seen over the course of the pandemic, and it's quite interesting. I think certainly a lot of countries, so if you look at the Royal College of Ophthalmologists in the UK, the French Society of Ophthalmologists, many of them have issued guidance in terms of how to manage patients in these unusual times. And I think really there's two elements to it. One is actually they're going back to fixed dosing. So if you look at the Royal College guidance, they say actually you should be treating with an 8-weekly interval, with no monitoring in between. So really to minimize, again, the exposure, the time out of home for the patient. But also, like you say, if they're on a treat and extend regimen and they're on a particular interval, say 10, 12 weeks, whatever it may be, I think, clearly maintaining that is a great benefit in this environment, because hopefully, if a patient's on that type of interval, they won't need to come to the clinic during that sort of acute phase of the pandemic, and therefore still maintaining good vision outcomes, but being able to defer that injection is really important.
Right.
But I think as we move forward, I suspect there's going to be greater interest. I think we've seen over time, certain countries are moving towards that treat and extend approach, and clinicians are more open and accepting of that. But I think as we come out of this pandemic episode, I suspect there's going to be even greater emphasis on that, and that desire to really minimize the number of injections, but still really trying to achieve those optimum outcomes. Those types of really cool innovations, I think, are going to be more of what we're going to see in the future.